Everybody just completed the HESI prep assignment. How was that? Was that good preparation for you guys? I know it was a long assignment and it was a full-term assignment, but um, you should have been. It covered the topics that we've been covering over the term plus some. There were some topics on your HESI prep sheet that we did not go over specifically in class, but you guys were asked to go back and do some research on that. Um, most of it was covered in class, at least the topic. So how did this HESI prep assignment help you for HESI? That's where I'll start. How did it help you? Did it help you?
Yeah, so it was basically like a refresher going over the terms and stuff and basically knowing what it is. So when you see it, you can kind of decipher and pick the answer from that.
Right, exactly. Okay. Thank you, Tyra. What about the rest of you? Tell me how it helped you. Were the topics familiar to you?
A lot of them were. Some of them weren't though.
Okay. Um, my understanding, this is my first term teaching PN, but my understanding is that that list of topics came from the review of the last two terms of HESIs for topics. Remember, this is only the third term that the HESI is being given in the PN program. And so that list came from reviewing the topics that were asked about in the last two terms of HESIs. So that's really good. Um, um, we don't know the questions for the HESI because it's more like an NCLEX, right? Where they pull from a bank of 1,000 questions and that's how they come up with it. We don't develop the HESI exam. Okay, we do develop the exams 1, 2, and 3, but the best we can do for you guys for HESI is to review the topics that were covered in previous HESIs. And for this, it's a current list because the HESI's only been given for 2 terms. Okay,
Professor Marvel, I have a question about the HESI. I know you said that so y'all pull from the previous HESI and give us the topics that were related to that. So how do you know like the HESIs won't change?
well, that's why we review them every time they're giving, and we add to our lists of this question was asked or this question wasn't asked, and we'll cross it out. So
Okay.
we just try and stay on top of, so for example, after all you guys take the HESI, uh, I'll take a look at it. I can't see the questions,
Right.
but I can see the topics. And then I'll go through that HESI prep and see if there's anything that needs to be added for next term or anything that needs to be taken out.
Okay.
So, yeah, we can't see the questions, but we can see the topics. So at least that's good though.
I
Um,
I also have a question.
sure.
You guys, for the community, for the community teachers and everything like that, you know how we have the practice exams for like med surg and peds. They don't have a practice
I know.
exam for community.
Right. Right. Yep, that is correct. And that is on my list to be asking about for going forward. But you're right. They do not. So and again, we've only been doing the HESI for 2 terms. So yeah. So you mean your practice HESI?
Yeah, because the other classes we do have to practice HESI.
Yeah. Yeah. Yep. Yep. Absolutely. Okay. Let's see. What other questions do you have? So in essence, that HESI prep assignment is your summary of the topics that were covered on the last 2 terms of HESI's. And it was meant to be a kind of fill out as you go over the term. I'm not sure who did and who didn't do that. It probably was a lot of work if you didn't.
Yeah,
Um,
because we didn't know. That's what I was about to say. I think if it was specified in week one about the HESI assignment, that would have been a lot easier for my class. I could speak for that. We didn't know until
oh,
about the week before. It was due.
oh, um, okay, so you guys weren't given the HESI prep assignment at the beginning of the term.
No.
Oh, okay. All right, I'll make a note of that. I gave my three classes. You guys tell me, Hannah, since you have your camera on, you guys got that probably week one or week two?
Yeah, you sent it out week one after our first like Zoom meeting.
Okay.
I just totally spaced it and forgot about it, but that's on me. That's not on
Mhm.
you. I forgot about it personally, and I know the girls in my class also forgot about it. But yeah, you sent it out. It was there.
I tried to send it out in week one and reminded you guys probably weekly in class, or at least every other week. Are you keeping up with your HESI prep assignment? Because it's going to turn out to be a big project at the end. Pardon me. And I would instruct my class at every couple of weeks, go through, highlight the subjects that we covered over the last couple of weeks, highlight those subjects in your HESI prep, and fill it out then so that you didn't have this huge project at the end. And then uh, the other thing too is I try and end class early because a lot of my classes are going to another class. So I try and encourage the students to, take that gift of time that I give at the end of class and fill out your HESI. Go back to your HESI and fill it out. What did we just talk about? Check it off, fill out the box. So that way, come week 10, it's hopefully almost completed and you just have to cover. So anyway, I'll make sure that I provide that feedback because, yeah, I mean, I know it's not due to week 10, but to me, it's kind of a term project. So, okay. What else? What are your other questions? Is everybody scheduled for the HESI?
Yes.
Everybody's scheduled. Okay.
I do have another question. So as far as like how the question not how the questions are worded, but as far as like what to look for, I think Professor Kershaw was saying when you're like for public health nursing, the main priority is safety, like safety and ABCs. So is that as far as like how to looking at ways except for the concept of how to answer the questions, is that what we should be looking for, safety
Yep.
and ABCs? Okay.
Yep. This is what I'm gonna go through with you guys first. I pulled this from MedSurg. Okay. These are how to critically, now we know that a lot of this community class is MedSurg focused. Can everybody see my screen?
Yeah.
Okay.
Yes, we can see it.
I go through this in all my reviews, all my HESA reviews up in the RN program, in the PN program. This is an excellent tutorial. And I've sent it to all you guys. This was part of the resources that I sent you guys in, I think, first part of week 2. Okay. I pulled off a
Is
whole
it
bunch.
is it possible to get that recent
Um,
that
it's in your
document?
it's in your announcements. Go back to week 2. There's 2 emails. There's 1 or 2 emails that say resources, test taking resources. And maybe while we're online, while I'm going through this, you can go back to your announcements and see when you can find it.
I'm
Okay.
checking now.
Okay, good.
You said week 2? I'm sorry.
It's either week 1 or week 2. I try not overload in week 1. So it would have been test taking strategies. And there would have been a few links to some different PowerPoints. So I want to go through this one. This is my favorite one. Even though I send you a lot, this is my favorite one, right? It comes from MedSurg, but a lot of this content for us was MedSurg focused. And this is how to critically think about answering questions. Um, whoever's looking it up, let me know when you find it. Okay. So this PowerPoint contains 10 practice questions, right? These hints are included to help you think through each question. Okay. And then the rationales are included to help you complete the thinking process. Okay. So, okay, so let's look at this scenario. Okay. The nurse is managing the care of a client with cholecystitis. The client has been adhering to a low-fat diet. The onset of the manifestation warrants the most immediate intervention by the nurse. So what are some key words in that? What's a key word?
Immediate.
Immediate. Okay. So questions in the HESI have those priority either question or words or phrases. Okay. And they're probably not going to be highlighted like we do in exams 1, 2, and 3. Okay. So you've got to really, really read the question.
It's Professor Marvel. It's cholelithiasis. Is that kidney stones or gallstones?
Gall.
Okay.
Okay, so here's your answers. A, B, C, D. Okay, so let's look at what the hints are of how to think about the question. Does the question have a positive or negative focus? Okay, if it has a positive focus, then we're going to be implementing an intervention. Okay, these are just strategies for answering questions. Okay, you have to find out what are the key words in the question. Okay, so the keywords in this question were cholecystitis on a low-fat diet and when the onset was. Okay, so then rephrase, once you have answered though, is it a positive, negative? What are the key words? Then try and rephrase the question. Okay, so the example is, which symptom in a client with gallstones who has been following the diet needs immediate nursing action? Okay. And then you can start to rule out the options. Okay. So if you know the dark foamy urine is expected in clients with this, right? You can rule out the rest of them. Right? So those are your hints for this question. Does it have a positive or negative? What are the key words? Then try and once you pulled out the key words, rephrase the question in your head and then see what you can rule out. Okay, let's do another one. Oh, this is still part of it. Sorry. So rationale. All these symptoms indicate at least some degree of obstruction of the bile duct, right? But the most acute problem is the severe pain of the biliary colic. Okay. And then what should you do? The nurse should administer an analgesic. Require ongoing A and B, require ongoing assessment and documentation. And then administer the antipyretics. Will reduce the discomfort.
Professor Marwa, I'm sorry.
Yep.
So two things. One, I looked in the announcements and I'm still not seeing the test taken, the document that you said you sent.
Okay.
It should be under mine is on the second page under week 2. If you scroll down, it should be like 3 different ones. She sent one from Dean Brown and then 2 additional ones with these slides on it.
Right.
You said it's on the second page.
Yeah, that's how mine was.
Okay, I'll have to keep looking because I looked and I clicked on everything from week 1 to week 2 and I haven't seen it. But my second question was, so is the community HESI, is it a lot of med surg on there?
Yeah. Well,
Okay.
think about what we covered in class the last couple of weeks, right? It was heavily med surg focused, right? All the conditions we went through, it is
Yeah,
med
but
surg.
I thought that it was going to be more so like the home health, the migrant workers, stuff like that. I mean, I'm fine with the med surg, but I
Mhm.
just wanted to know like what the
Yep.
focus is.
Well, it does have a med surg focus
Okay.
as well. Okay, because remember, in community, you're bringing everything together, right? You're bringing all your previous learnings together. You're bringing your peds because you're taking care of clients across the whole lifespan. So you're bringing together your peds experience, your OB experience, your mental health experience, your fundamentals, med surge, right? Because you're now out in the community, can be can be taking care of any age group of clients with any kind of medical health condition. Right. So med surg is really, really important. Okay. Keep going. What other questions do you have? Oh, there's the rest of it. Okay. So let's finish up with this question. So we went through that. Okay, here's another question. Which equipment should the nurse obtain prior to performing the initial assessment of an 8-year-old with a suspected bacterial epiglottis? Okay, so let's think about these hints. Okay, there's your 4 answers. Does it have a positive or negative focus? Well, it has a positive focus because they're asking what equipment should we obtain? What are some key words? That's what this is. The key words is what to pull out. What are some key words in that question? The age of the client, right? What part of ADPI are we asking to do here? Remember, ADPI is all throughout community. It just looks different than, say, a hospital patient. So what part of ADPI are they asking about here? Asking for you to do?
Is that assessor intervention?
Assessment. It says
Assessment.
it's asking you, a keyword is initial assessment. So you know you're in the assessment part of ADPI, right? We know that the child is 8 years old. We know that the health condition is epiglottis or involves the epiglottis or epiglottitis, and then equipment. Okay, so how might you rephrase that question now that you know all the key words? Right here. How do you assess for epiglottitis in an 8-year-old? Right? And then how do we rule out answers? Okay, well, this is an acute problem, right? So you can certainly rule out that you don't need a growth chart, right? Are you guys following me?
Yeah.
These are the, okay.
Yes.
Okay. So, nope.
You want us to like answer their questions, or are we just following along?
No, I want you to jump in and answer.
Oh, okay. I thought we were following. Okay.
No, no, no. So the child with epiglottitis requires pain assessment, right? A is an approach. Have you guys learned about this FACES pain scale in pediatrics?
Yes.
Yes. Okay, good. So A is an appropriate pain assessment tool for an 8-year-old. We know that B and C should not be used because an airway spasm could be induced, and that's the last thing we need. And then we know we already ruled out that growth chart we don't need.
So how come the trick setup wasn't, I don't know if you know why it wasn't an option, but why wouldn't it be one of the things? Because we were like, it was drilled in our head when somebody has epiglottitis that they would need, like, you have to make sure that you have something there to secure their airway. So even if you're assessing for, you would still want to bring like some kind of airway equipment because their airway could close.
Well, but remember, that's all that's correct, but that's not, if it's, how do I say this? They're asking for equipment, and if that's not in there as an answer, right? Then what would be the next, okay, they're asking for an assessment. That should be one of your keywords, assessment. So you don't know if you're going to need a trach setup. You don't know if you're going to need all that information. Don't read too much into the question. We're still in the assessment phase. How do we even know what we need if we don't do an assessment? And what's the best way to do an assessment? Through the FACES pain scale. And then we can decide what we need. So that trach equipment is not necessary at this point. Or at least the question is asking, how do we do an initial assessment? Well, that wouldn't be trach equipment, right? That would be part of the plan. That would be part of the intervention if we needed it. Does that make sense? So don't read too much into the question.
Yeah, it does.
Okay. Excuse me. The nurse should question a prescription for the initiation of an IV heparin infusion for a 50-year-old male client based on which serum lab value? Okay. So is this a positive question or a negative question? It's a negative question.
Negative.
Yeah, because the nurse is questioning a prescription, right? Okay. So keywords, IV heparin infusion and serum lab value. That's what we're pulling out as what is she questioning? She's questioning the infusion. She's questioning what value we're going to use.
Would that be the INR?
Well, let's keep going. Hang on. Let's rephrase that question. Okay. So how would you rephrase it? So now that you know that this question involves an IV heparin infusion and a serum lab value, how might you rephrase it in your head?
What tests they use?
Yeah, exactly. What lab value would be a possible contraindication to start a hep infusion? Right? And we know that B is a normal value. So she wouldn't be questioning that, correct? So we know we can rule out B. Okay. So,
So Professor Marvel, I have a question. So I picked PTT in my head, so heparin is always PP. Heparin is associated with PTT and warfarin is associated with INR.
Correct.
Okay.
But again, this would be a question that you would need to know values. Okay, a PPT of 120 seconds is very high, okay, indicating a prolonged clotting time. And therefore, that's your contraindication of why you wouldn't start a heparin infusion. A and B are within normal limits.
But see,
right?
we didn't learn that.
No,
We didn't learn that deep into it. We just learned which, far as like for warfarin and heparin, we just learned what test is associated with it. They didn't teach us like the intervals as to
okay.
the timing.
And this PowerPoint is intended to learn how to answer questions. Don't worry about the content of these questions. We're just going through how to answer a question.
Okay.
Does that make
Professor
sense?
Marvel, I was looking through the announcements. I don't see this PowerPoint. I checked week 2, everything that was sent out.
And who's speaking?
Tyra.
Okay. Maybe Dr. Kershaw didn't send those out to you guys.
Yeah, I think he
Yeah,
did.
because I don't see it either.
Okay. 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 And you know, this is, I mean, we do things differently, right? So this is something I send out to my students. I can certainly share it with her, that I send these out, and if she'd like to send them out to her students. So what I might do is take those 2 announcements. I know you guys got the announcement containing Dean Brown's math tutoring, correct?
Yeah. Yes,
You
I
got
seen
that. Yeah. So I'll just share with you after this. I'll just share with you the 2 announcements. Okay?
Okay, thank you.
Thank you.
You're welcome. So again, don't worry about the content of this PowerPoint. This is just going through how to answer questions in an NCLEX style. Okay? Okay. Next question. A client with renal insufficiency is admitted with bradycardia secondary to hyperkalemia. In planning care, which nursing diagnosis has the highest priority? What are the key words? What part of the ADPI are they asking about?
The planning part, the P.
Implementation.
Diagnosis.
Diagnosis. In planning care, which diagnosis are you going to be using? So, does this question have a positive or negative focus? It has a positive focus, right? Because it's asking about what's the highest priority diagnosis.
Well,
And we
Professor,
just,
I'm trying to rule out the question, and I guess it's difficult for me because I'm looking at hyperkalemia, looking at high blood potassium, and I know potassium is opposite of sodium. So if potassium is high, I would expect the patient to not be retaining fluid because I know water follows where sodium is. So this is tricky.
well, we haven't got to let's go through the question and then let's see if you understand it better. Okay.
Okay.
All right. So it's a high priority question, or excuse me, it's a positive question. And we know from the last question, it was negative. The negative question was, we are questioning a physician's order. Okay. So this is the opposite. Okay. Does it have it's positive because we're looking for what the high priority diagnosis would be. So what are some keywords that come out of here? Okay, we know they have bradycardia due to hyperkalemia. And we know that they also have renal insufficiency, correct? So then try and rephrase the question in your head.
Is it C?
Okay, hang on one second. Let's try and rephrase the question. How would you rephrase the question now that you've pulled out the key words? Okay,
What
here?
diagnosis is related to the problem?
Exactly. Which diagnosis is relevant to the situation and requires the most immediate attention, right? To ensure basic homeostasis or safety. Okay. Once you pull out the keywords, you can restate the question in your head. Okay. And so are there any answers that we can rule out right away?
B.
Pardon me?
Altered cardiac output.
No.
B.
We can rule out D, correct?
Yeah.
because we know that impaired nutrition is not life-threatening, or is usually not life-threatening. Okay? There's usually one or two answers that can be ruled out, and that's what we have to do at the beginning. So let's read the rationale. Okay. Bradycardia is a result of altered cardiac output. So that would be the correct answer, which will be worse if hyperkalemia is not resolved. Okay, this is the most life-threatening and therefore the highest priority diagnosis for the client. Okay, because remember, the question was asking, it was a priority question. What were they asking? What's the key word in there in the question?
Is it bradycardia?
Priority. It's a priority question. Which diagnosis has the highest priority for this client? Okay. The answer is B, because A and C are important, but they are less of a priority than B. Okay. So do you understand how I got there? You have to be able to pick out priority words. Keywords, I call them keywords and priority words. What information do you need to pull out as keywords so that you can restate the question in a simpler form, right? And then are there any priority words in the question? Most, least, priority, first, last, greatest. You've got to be able to pull out those words. If you don't pull out those words, you're probably going to miss the question. Okay, so right here, the highest priority. Did you guys pick up on that?
That was what I said.
Okay, good.
That was what I said. I said B.
Oh, good. Okay, great. Okay, let's keep going. Which instruction is most important? These are just sample questions that we're breaking down. This has nothing to do with the content of your HESI. Okay, we're just breaking down to help you answer questions better. Okay, which instruction is most important for the nurse to provide to a client who has splenomegaly? Okay, positive or negative question? It's a positive question, right? What is the most important instruction? What are some key words?
The teaching.
Teaching. And what else is in that? What else is in that question that would jump out at you?
Most important.
Most important.
Most important. So that could mean that all the answers are correct, but what is the most important? Okay, so teaching and most important are those key words to pull out. So let's try and rephrase it in simpler terms. Which instructions are critical to teach a client with enlarged spleen? Doesn't that sound simpler?
B.
Okay, hang on one second. What answer can we rule out?
A, taking the rest periods, because it's not like a
Exactly.
dire do, but they should do it.
Exactly. Excellent. Okay, so the answer is B. Okay, do not lift heavy objects. Why? Rupture of the spleen can occur when people with enlarged spleen lift heavy objects. And remember, it was asking most important. So B is the most important instruction to provide the client. And here's an example. A, C, and D are also important, but they don't have a priority, right? A ruptured spleen is a life-threatening issue. You guys with me?
Yeah.
Yes.
So we've had several priority questions, and are you picking up on those words? Okay. Which assessment technique will provide data to support a client's diagnosis of metabolic syndrome? So let's start. Let's start with, is it a positive or negative? So it's positive. What it's asking, what technique, which technique? Okay, so some keywords: assessment technique and metabolic syndrome. That's what we pulled out of it. So we could rephrase it and say, what are the indications of metabolic syndrome? How do you assess them? Right? Because the key words were, as far as ADPI goes, assessment. You're doing something, you're doing some kind of an assessment about some kind of diagnosis. Right? So we could rephrase it in simpler terms. What are the indications of metabolic syndrome? How do you assess them? Right? What can we rule out? We can rule out A, right? Because bowel sounds are unlikely to be related to a metabolic problem. So again, the thinking of, yes, don't worry about the content of these. You're thinking about more of the process. So rule out. What can you rule out with a question? Okay, so we know we can rule out A with this particular question. Okay, so metabolic syndrome, defined as 3 or more risk factors that predispose the client to heart disease, cerebral vascular disease, and diabetes. Okay, so risk factors include abdominal obesity. So what would you be, so thinking about that, what would you be doing? You'd be doing B, measuring the girth, right? Okay, so again, it's the process of, is it a positive or negative question? What keywords can we pull out? And then how can we rephrase it in simpler terms? And what can we rule out? Does that make sense?
Yes.
You want to try one more? I mean, I'm just trying to get you, have you repeat this process in your head when you're reading your questions. Okay. Do you want to keep going and do a few more?
Yes.
Okay.
Yes.
Okay, the nurse administers Kyaxalate to a client with renal failure. Which change indicates the treatment? And remember, this is a med-surg focused test taking skill. So this is why all these are focused on med-surg. Okay. Which change indicates the treatment has had a desired effect? Okay. So what are we looking at? Is it a positive question? Yes, we're looking at a desired effect. Okay, keywords, we have the medication, where the question is asking what the desired effect is, and we know that it's about renal failure. All right, so easily rephrasing this question is, what's the desired effect of the medication in the client with renal failure? Okay, so again, we can rule out C. Okay. Again, it's the process of those 4 steps. Okay. Let's keep going. LPN reports to the nurse that an 86-year-old postdoc client is becoming increasingly confused, and she can't do her incentive spirometry for the last 2 days. The client is scheduled for discharge and has not yet learned to perform wound care. What is the priority for the nursing action? What are you picking out of this question that you'll need to answer the question?
That the client is confused.
Mm-hmm. She's
Her
confused. Her
and
age.
the priority.
What's the key word? What's the key word in this whole question?
Priority.
Priority. So again, don't be fooled. All the answers might look correct, right? But and you know what? That's another tip. If all the answers look correct and you're confused, go back and read the question. If it's not a select all will apply, it's looking for one answer, and you start reading the questions and you think, oh, that looks, yep, that seems right. That seems right. There's only one answer. So what should you do? Go back and read the question and see if you missed a key word. Does that make sense?
Yes.
And one of the key words listed here in your hints is priority action. Okay. And so if you rephrase it to yourself, you might think, what is the most important intervention with an elderly post-op client who becomes confused?
B.
Okay. So we know that we can rule out, based on what we know, that wound care may be important, but it's not the highest priority. So we can rule that out. Think ABCs here. Is that why that's why C's the correct answer? Right? Confusion is the first sign of respiratory infection in the elderly. All right. So they're asking, what's the priority? The question is asking, what's the priority nursing care? So you need to think ABCs. Right. So you'd be assessing breath sounds and oxygen. The other ones are, I mean, all of the other ones are okay. They're okay answers. They're not wrong, but it's asking for a priority. Make sense?
Yes, it does.
Which adaptation of the room environment is important for the nurse to include in the plan of care of a client with neutropenia? Okay. Keywords: environment and neutropenia, right? Which adaptation to the environment needs to happen with a client with neutropenia? So you have your keywords are your environment and your neutropenia. And so maybe you rephrase it into simpler terms for yourself. What's important when managing the environment of a client with neutropenia?
A.
Okay. So what can we rule out?
A.
We can rule out B, because neutropenia does not cause photosensitivity or photophobia. Okay. But remember, they have neutropenia. So what is important?
They got weak immune systems.
Right. So so D looks good because if they're that at risk to clients, if they're that at risk to infection with their lowered immune system, what it's asking you, what is important? Well, minimize exposure to visitors, right? Right? Because that helps reduce the risk of possibly getting an infection. Okay. Which client warrants the most immediate? Okay, so there's another priority phrase. Immediate follow-up by the nurse. Okay. What are your keywords? Immediate, right? It's a priority question. So maybe you think about it as thinking about triage. Which client is most critical? Which client is the least stable? Which client is the highest risk? And in this question, we can rule out A because hyperthyroidism does not require immediate intervention. Okay, so now you're down to 3 answers. Okay. And D is correct because it's so which requires the immediate attention. So you're going to be looking for a life-threatening disease, right? Or something that's extremely serious, right? And so D would be the correct answer.
Professor Marvel, I have a question. So would the tremors indicate that that blood sugar is low? I'm just trying to make the connection.
Say that. I'm sorry. Say that again.
I'm confused as to why D is the answer.
Okay. Well, Addison's disease, along with, yeah, exactly, the diaphoresis. Yes. Right. You have to respond to that situation first, because Addison's disease with diaphoresis is a crisis situation.
Okay.
Okay. We already ruled out A. A is not a life-threatening problem. B and C are serious, warranting actions as soon as possible, but they're less immediate than D. Okay. Okay. So that is, whoops. I want to go over this one with you. This is another good one. Okay. Okay. Test taking techniques to enhance preparation and study for an exam. Okay. It's all about preparation. Okay. 10 steps to answering a test question. Okay. Cover the options. When I do my reviews, I tell students this. Try and read the question, look away, or cover the options and see if you can answer the question in your own head. Okay. So cover the options, read the question, just determine if the style is positive or negative, identify the key words. We just went through these few of these in the last one with your hints. So is it positive or negative? What are the key words? And then when we rephrase it, we're essentially saying what is really being asked in the question, right? Because with some of those questions we just went over, there was a lot of fluff in the question that we didn't need. What's really being asked, right? So that's number 5 and 6. Rephrase the question in your own words. And then uncover the options and look for one that is the closest match to your own answer that you come up with in your head. Review the other options, rule out. We already just did some practice with ruling out. And then you have to consider the options that are left. You may be able to rule out one answer, maybe 2 answers. Consider the options that are left based on your nursing principles and your knowledge of the subject. So I would add to that so consider the options based on nursing principles, which include ADPI, which includes safety, okay? I should have done this one first. So here's their suggestion. Use a sticky note to cover the choices. And this is from Elsevier. Use a sticky note to cover the choices on the monitor. Covering the answers helps you prevent you from being distracted for the correct answer. Read the question, read every word. Do not read into the question. I cannot stress that enough. You only need the information that is right in the question. Okay. Don't, well, what if something happened, or what if, get rid of the what ifs in your head. Okay. And here's more information about why we want to determine if it's positive or negative. So if it's a positive question, they may be asking what the nurse should be doing, or what's the best first action to implement. Right? So what should the nurse be doing? A negative may ask what you should avoid. Like, what prescription do you need to question, or which behavior indicates the need for intervention? Okay. Or it needs reteaching. So those are those questions you got in your exams where it said, where a new nurse is orienting a client to whatever. What does the new nurse say that might indicate she needs more teaching? Right? So you'd be looking for something that an answer that's kind of inappropriate or not correct, right? Does that make sense? So that's a difference from positive to negative. And you had several questions over your first 3 exams asking it in the negative way. And a lot of people got those wrong, because you're looking for, what do you avoid? What do you need to correct? A parent's you're working with a parent of you're working with a child of a parent who lives in a smoking home. What might the parent say that would indicate they need more education on the effects of asthma with kids? Does that make sense? So what kind of answer would you be looking for? Something she says that's inappropriate, or she needs better teaching on, or more information. Does that make sense?
Yes.
Okay. Find your keywords in the question. Which words or phrases provide critical information? Could be the age. We just went through these in these questions. Could be the age, the setting, the timing, symptoms, behaviors, or whatever critical information. And we just pulled out keywords in some of those questions, in all those questions. Okay, here's a good example. The nursing actions for a 10-year-old 1 day post-op are different for those for a 70-year-old 1 hour post-op. Okay. So you have to be able to pull out words or phrases that provide critical information. And that also is what's not in here, but I would add is any keywords about a priority. Is it a priority? Are they asking for the first, the last, the greatest, the most, the least, what's the first immediate step we do? Okay. I cannot emphasize that enough, that if you read the question a second time, have a piece of paper next to you, read it the first time, and write down any keywords that come up. Okay. And then read it a second time. Did any new words come up that you might have missed? There's a lot of questions in the first 3 exams that were missed because of missing phrases or words like that, priority words. What is the question really asking? After you've thought about those first few instructions of breaking it down, picking out keywords, what are they really asking? So try and rephrase it yourself. Okay, assuming your answers are still covered, rephrase the question in your own words. What are they really asking? This will help eliminate non-essential information in the question. and will help you determine the correct answer. Okay, rephrasing the question in your own words. Every test writer is different and each one has their own writing style. So sometimes writers will use terminology that may not be familiar to you. Do not be confused by a change in writing style. Rephrasing the question in your own words may help you to understand the meaning despite the presence of unfamiliar terms. So if you get to a question and don't get confused if it is not the normal way that questions have been presented to you, still focus on pulling out the key words, the key terms. Okay. And then uncover the options is the next step. Look for one that maybe matches your answer that you have thought about based on the prior steps. Okay. The person who prescribes treatments may be referred to as a physician or a healthcare provider rather than a doctor. Okay, the unskilled person who assists the nurse may be referred to as a nursing assistant, a nurse's aide, patient care technician. Okay, so some of these may not be familiar to you, but you have to open up your mind to be able to accept different kinds of terminology, even though that may be not what you use in your facility. Orders may be referred to as prescriptions. Okay, these are just some HESI hints. Okay. And then reviewing the other options and rule out any options that are clearly incorrect. Based on your knowledge, you can probably identify one or two options that are clearly incorrect. Those get crossed out. Mentally mark through the options in your head when using your computer. Okay. And then throw those two out. They're not part of the question anymore. And then you have two other answers that you get to choose from, or three. And so now you have your options left after you've ruled out one or two answers. Okay, now you're going to have to differentiate between the remaining options. Okay, you're using your ADPI, your nursing principles, nursing process, and your knowledge of the subject. Okay. Okay, so you're considering right here, roles of the nurse, nursing processes, ABCs, safety, Maslow's hierarchy of needs. Okay. Okay, the test doesn't allow for your option for skipping questions and returning them later. So you need to practice answering every question when it appears on the screen. And that's what's happened the last three tests. You can't go back. Okay. Use this as an opportunity for positive affirmation. You know, I'm prepared for the test. I know this stuff. I am sure. Okay. The one thing I'll jump in here and say is if anybody has a habit of changing answers, my tip for changing answers is you have to really be able to convince yourself why exactly you're changing, black and white. You have to be able to convince yourself why you're changing your answer. You have to have a good reason, a good rationale. Not, well, you know, or if you're uncertain. Uncertain is not a reason to change your answer. Uncertainty. Okay. You have to be able to have a real good reason. Correct answers to most test questions are based on generally accepted norms. Okay, many healthcare agencies have specific policies or procedures that may vary from the generally accepted norms, but typically Most questions are based on generally accepted norms, and not trying to trick you. Okay, students with clinical experience outside the school setting may erroneously consider factors that are not part of the question. So for example, a couple terms ago, I had a student in the RN program who was a paramedic. He was an EMT. I'm just giving you an example. And he was not doing well on, or he did not do well on the first exam. When we did exam review, it was crystal clear that he was bringing his EMT experience into the question, adding all this additional thought about, and I remember kept saying to him, where did you get that information? Well, this is what we do in our job. Well, that's not part of the question. Okay, so you need to be careful. Okay, you need to focus only on the question. Do not bring your outside clinical experiences into the question, because you're going to add more confusion. Okay, this is based on knowledge of the subject, nursing process, and you're dealing with the answer to the correct answer to the question is right in the question. You're not expected to think, well, what happened in the past? Well, if I answered this, will this make it worse for the future? No, no, no. Just read the question. That's all you need. Oh, okay. Your answer to the questions should be based solely on the information provided in the question. Avoid referencing your work experiences. Avoid playing that game, but what if? I can't tell you the number of times when I am doing reviews with students, I ask them, so why did you select that answer? Well, but, you know, if this is going to happen, then that's why. Nope. All the information you need is right in the question. In a world of testing, unless you're told otherwise in the question, you have an unlimited amount of time, staff, medications, and equipment. Okay? Don't second guess yourself. If you've studied and prepared questions, if you're studying prepared, questions may seem easy or just plain common sense. Trust your answers. Okay? So I figured that today I'd like to spend more of my time with you on test taking. Okay. Oh, hi, Dr. Kershaw. So is this helpful?
Very
Yes.
helpful.
Are you sure? I mean, you've just most recently covered your HESI prep, so your topics should be pretty well current in your brain, right? So I thought I'd take the approach of test taking skills, how to think about questions, how to approach questions, how to answer questions, how to rule out answers. That's kind of the whole exercise we just went through over the last hour.
I have a question.
Yeah, of
Two
course.
questions actually.
Yeah.
My first question is, do you know of any websites besides like Quizlet or something where you could take or you could like do questions that's kind of around community nursing, so that way we can have some kind of like mental preparation as far as how the questions will be asked? Like, do you know any specific, like any sites?
No, I do not. Have you guys been doing your practice HESI questions in your student resources?
What practice questions? In the HESI book?
Yeah.
Which section though? Would that be med surg?
No,
Will we
just
use the med surg section?
in general. Don't you guys have weekly HESI questions?
Oh, the NCLEX questions?
NCLEX questions, yeah.
Oh yeah.
Yeah. Have you guys been doing those?
Yeah.
Yeah, I do those, and I also use this book here.
Okay. What
Yeah.
section do you use in that HESI book? Are you using the med-surg section?
I don't,
Teresa?
I've been told there's no community section in that book.
No, it's not.
Correct. So, okay,
I was asking Teresa because she said that's the book that she's using.
What did I say at the beginning? Community nursing is all about pulling in all your other expertise, right? Especially your med surg, your OB, your peds, your mental health, your fundamentals. Why? I said that at the very onset of this review.
So it's just a mix of everything, basically.
You in the community, you're taking care of clients across the whole lifespan, from infants all the way up to the elderly and everything in between.
I know for me, I did the med surg section in that book, like the practice questions online when you enter in the code. And I was getting questions on like tertiary prevention, secondary prevention, and primary prevention. And that was in the med surg practice questions from that book online.
Okay. All right. Thank you.
Thanks, Hannah.
And then my second question is, do you know when we'll get our grades for exam 3?
Dr. Kershaw and I are meeting after this review and going over the exam. And so we hope to have the grades posted in a couple hours.
Okay. All right. Thank you.
Does that help?
Yes.
I want to clarify something. We don't have Zoom this Tuesday, right?
No,
We don't
we're
have
done.
classes.
You guys have had, yeah, I'm going to send an announcement over the weekend. Okay. We're fully into HESI now.
Okay.
Okay. There's no classes this week. No.
Should we still do the live attestations? I think they're still on there for 11 and 12.
Yes, because
Okay.
there has to be some kind of attendance. And don't forget, this week, even though it's HESI week, you have an NCLEX assignment, correct? Don't we?
Yes.
I thought we do.
Yeah.
Yeah. So maybe if you haven't done it yet, maybe just when we're done here now, go do your NCLEX assignment so you get it out of the way and you're not trying to fit an NCLEX assignment in the middle of your HESIs this week. Just do it when we're done here. Okay? That's my suggestion. Has this been helpful to go through this? These kinds of test-taking strategies and tips?
Yes, ma'am.
Yes.
Okay. Read the questions. Pick out the keywords. Don't change your answers. Be confident. You know, I was so impressed with the HESI prep assignment. Of course, I'm speaking for my students. I mean, they were unbelievably good. They really, really were. And so that tells me that you guys have an understanding of those topics. Okay. And so if you're doing further prep, I would be sticking to that document. Okay. I would also pull up, if you want, you can pull up your 3 study guides from your exams, right? Because that just supports a lot of the information in the HESI prep. You know, patient teaching, patient education, all the topics we covered. And of course, there were some boxes that we didn't cover in class. Okay, we covered the topic, such as bioterrorism, but the bioterrorism in general, but your HESI prep review asked about a couple of specific issues. So use your 3 study guides as well. Okay. So your 3 study guides in your HESI prep assignment. That's all you need to review. And before I forget, anybody that came in late, and there were a lot of people that came in later, please put your name in either myself or Professor Kershaw in the chat so that we can make sure we take attendance. And when we meet with your deans on a weekly basis or every other week, we always share with your deans who's come to reviews and who hasn't. And we know we know that attending live reviews really does help students do better on exams, including the HESI. So I wish you guys all the best of luck on your HESI. We'll post exam 3 grades in a couple hours when we get done meeting, and we'll go from there. Okay, thanks for coming and taking the time. I hope it's been helpful. And then I'll stay on if anybody has any questions.
Thank
Okay.
you.
You're welcome. You're
Thank
welcome.
you.
Have a good weekend.
Thank
You're
you.
welcome. You're welcome. Remember, Dr. Kershaw has a review tomorrow night as well. Okay.
Yes, I do.
Hey.
I'm so sorry for you, bro.
What's meeting? Okay.